All right, this is sixth grade health, pages 46 to 50. Poison, that's what we're going to talk about today. So, poison is any substances that cause harm, illness, or death. All right, it might be drunk, it might be eaten, it might have affected your absorption, like you might have been able to absorb it through the skin or a bite, something along those lines. Poisonous substances include plants. All right, so usually plants and that kind of thing we call poisonous. Animals, bites, and that kind of thing we call venomous. But of course, we're talking about household products: paint, turpentine, gasoline, bleach, cleaners, ammonia, whatever. Expired medications that's too much. I think that my son drank shampoo when he was little, and I had to call poison control. We just gave him lots of water and hoped that his diaper didn't, bubble up. So, anyway, poison can lead to, of course, really terrible things. So, respiratory nervous malfunctions, shortness of breath, convulsions, throwing up, any of that kind of thing. So, immediately call 911 or the Poison Control Center. If it's something where they're just like, you're like, okay, something, we don't really know what to do, we don't know what happened, but they seem okay, call Poison Control. Poison Control is 1-800-222-1222. That's something really you should have in your mind. You should know it. 1-800-222-1222. So, sorry, that's messed up. So anyways, but if you really have an issue and the person's convulsing or any of that kind of thing, then you definitely want to call 911 first, so they can get the proper personnel there. So make sure you get instructions from an authority before administering treatment. There's things that can make them throw up. They're going to tell you what you need to do. Basically, drink milk, drink water, drink this, do this, make them throw up, whatever. They'll tell you what you need to do with that. Because a bite from a venomous snake can be fatal, cause death, then any person bitten by a poisonous snake needs to immediate treatment. First of all, and I know that this is weird and hard, but remember we're trying to stay calm in any case of emergency. You want to at least try to get a picture of a snake that bit the victim, or be able to really look at them and say what kind of snake it looked like. That's important because they need to know what kind of snake it was to be able to tell, is this a poisonous bite? Is it something that's just going to make you a little sick, or just be careful of infection, or it's something that could kill you? So different snake bites require different types of what they call anti-venin. It's venin, not anti-venom. It's anti-venin, venin. Venom is the stuff that is from the animal. Anti-venin is what the doctor will give you if you have a serum that treats snake bites. The doctor's going to be able to need to identify the snake in order to be able to give you the proper type of anti-venin. So first of all, keep the victim calm. That's our first rule of everything medical emergency. Clean the wound. Get it out as quickly as possible. The venom. You want to clean the wound. A constricting band, something that you can kind of slip a finger underneath. That, not a tourniquet where you can't get, but just like a constricting piece of clothing or something, just kind of tied up around where it would be. Try to keep it below the heart. You want to below the heart to where it won't go to the heart there. You want the venom to not reach the heart is what I'm saying. So you want to slow the blood flow to the heart from wherever the bite was. And then a neurotoxin is something that affects the nervous system. And a hemotoxin, from hemoglobin blood, hemotoxin affects the blood and the cardiovascular system. And so different types of snakes have different types of venom. They have to use the different types of anti-venin. The coral snake, remember, red on yellow, kill that fellow. And so we would definitely want to know that. The ones around here, obviously, the rattlesnake, if you could hear that rattle, you see, whatever, you definitely want to tell the doctor that. A copperhead, you can even study that, look at that to know we should be able to look at them. Now, some of them around here really look like copperheads and they're not. So even the shape of the head's important on that one. Okay, moving on from that to burns. Burns are the leading cause of accidental death. They can produce extreme pain. Of course, provide months of care depending upon how serious the burns are. And the younger that the skin would be, so a baby is going to be affected more by certain types of burns. My great nephew, he accidentally pulled a cup of hot tea off onto his body. Well, I mean, if you poured hot tea on me, it might burn me and it might hurt, but it'd be like a first degree and it would just be red for a couple of days or something. But because babies' skins are so sensitive, he ended up spending like, can't remember exactly, but it was a week or two in the burn ward there. And that was, horrible for them to have to do. But we were just thankful that it didn't hit his face. It hit his chest in that area. But it was a large burn too. So that was a thermal burn. So if it's because of heat, it would be considered a thermal burn. An electrical burn would be something like an electrical shock would send to them. And then a chemical burn, some type of a corrosive chemical, could cause that to come into contact with your skin or your eyes or something along those lines. Sometimes a chemical burn, water can make it worse. So you have to figure out what type of chemical it was and let them help you with that. There's different degrees of burns. If it affects the epidermis, the top layer of skin, it's a first degree burn. I actually have one right now. Can you see that right there? I was cooking and hit the rack. I didn't realize the rack was up there. I just hit the rack, and I don't know if you can really tell much about it, but it's definitely affected the first layer, the epidermis there. I guess it was just for this lesson that I had that happen. A second degree burn actually occurs in the second layer there. And I had another nephew that had a second degree burn because he had some cooking liquid that got on his feet. And it stayed on there because you have socks and shoes and whatever. It was like in the bottom, and it kind of came out and it hit his feet. So anyway, it's characteristic by blisters, and it may have been third degree. I can't remember now. But anyway, red skin, swelling, extreme pain, that kind of thing. So it affects the second layer of skin there. Those could be immersed in cold water, cold cloths, dry. Keep the area dry after that, and then a sterile bandage keeping out infection. Remember, we talked about anytime you've got open skin, that's like the main thing that we want to try to help, is just to keep that infection out, reduce swelling, that kind of thing. And then you have a third degree burn, which you've got some pictures there if you want to look at those. And that affects your subcutaneous, your third bottom layer of skin there. And honestly, it's not as painful after a while because, at first, like the others are, because it's actually burning your nerves off there for a little bit. So, but it can affect it later. You're going to have some, it would be awful. The damage is so extensive. A lot of times they have to have surgery and skin grafts and things like that. Don't remove clothing. Get them right to, don't even apply cold water or anything. Get them right to a burn unit, a hospital that is specially designed to be able to help burn victims, that kind of thing. Keep the limbs elevated above the level of the heart so that the blood doesn't rush to that area. It definitely requires emergency medical treatment, emergency medical care. It's really, really very important there. Don't rub your eye for chemical burns. Chemical burns. You want to be able to, if the victim's skin comes in contact with a harmful substance, remove the clothing, because the clothing could just be causing worse burns if it's soaked through. And then rinse the area with low pressure water for 15 to 30 minutes. Now, I would double check with poison control that that's okay with that particular type of chemical. Most of you aren't going to be in weird chemicals that you would know that, but you never know. It doesn't hurt to check. Apply clean dressing to it. I would seek medical care. I would go to a doctor for a second degree burn. let them help you out there. Don't rub the affected area. Don't rub an eye, your eyes, if you get chemicals in them, just rinse them out for 15 to 30 minutes. That seems like a long time, but it's important. All right, and then learning the first aid procedures can help you have a good sense of accomplishment, helps you feel better in the more that we're prepared in an emergency situation, the better off we will be. Practice the ABCs of first aid, the airway. You're going to check the airway, check the breathing, check the circulation to see if that's there. So ABCs of first aid: airway, breathing, circulation. And then first aid care can prevent, obviously, a serious situation from becoming way worse if you can help them. And of course, the Bible talks about in Ecclesiastes 9:10, whatsoever thy hand findeth to do, do it with thy might. So you want to be able to be prepared so you can do have the best of your ability with that. All right, so that finishes up chapter 1, and I'm sorry, chapter 2, right? Yeah, chapter 2. That finishes chapter 2. And so reviewing chapter 1 and chapter 2 will help you remember, look at the bold, italicized sentences, bold terms, that kind of thing, as you kind of look through that and study that. And we'll get to the test and review and that kind of thing when we get back. Have a good week.